Do I start, Parag sir?
Yes, madam.
Okay. A very good evening to one and all. At the outset, first of all, on behalf of Group Framinghams, I would like to express my heartfelt thanks to Dr. Sanjay Bedi sir and all the respected facilitators for providing us a platform which has really enriched us with the latest updates to be imbibed and inculcated in the medical education. We Group Framinghams, Group and Framinghams started our journey with the motto of continuous learning and upgradation. And towards fulfilling that motto, we have arrived in the second phase of the presentation. We will try to do justice to the assignments allotted to us. And I hope that by the end of the session, we are going to have a brainstorming and a fruitful discussion also. So our group has a pan-India representation. So slide is not moving. Yeah. Pan-India representation with myself, Dr. Shalini. From North India, myself, Dr. Amanpreet Kaur, Dr. Bhupinder Kaur, Dr. Shweta Goswami, and Dr. Hitesh Singh. From the West, Dr. Venu Shah, then Dr. Prasad Pore sir, Dr. Sanjay sir, Dr. Chandana. From the South, Dr. Netras, Dr. Shweta Shri, Dr. Shrikant, Dr. Pumani, Dr. Saumitri, and Dr. Abha. From East and Northeast, Dr. Shatabdi, Dr. Visi, Dr. Ajanta. And our facilitators, Dr. Manjunath sir and Dr. Pankaj sir, to whom we will always be grateful for their due guidance. So our presentation will be in the 4 parts, that is formative assessment tools, assessment of knowledge, skill assessment, and logbook. I'm going to highlight on the formative assessment tools for the large group and small group sessions. As we know that in CBME, the major emphasis is on the formative assessment of the student. So because it's a continuous process of the scrutiny. And we have come up with this tool that is a model formative assessment classroom technique facts model. This model is a very useful tool because it helps in the timely diagnostic as well as the therapeutic mechanism for tiding over the learning issues created during the classroom instructions. The first technique is the classroom quiz. It can be through the oral, verbal, or visual ways. And the purpose is that what exactly does the quizzes does is that it's also known as the effortful retrieval of the what scholars can recall. And frequent quizzing triggers a process that enhances the long-term retention of just learned. So the process in brief is that after the class, after the topic is covered, at the end of the instruction, the students are given the 5 multiple choice questions as a PowerPoint presentation, and they are supposed to answer every question, and that is discussed in the end. So it fulfills the purpose of the formative assessment also by filling the gap, that is the self-assessment by the students, as well as diagnosing the knowledge gap which they themselves can also do. Along with that, the student gets engaged as well as motivated. The second technique is that second tool is the exit slip and ticket. That is a very in fact it's used also, that the exit ticket is simply a question that is posed to the student prior to the conclusion of the lecture, in which the student has to just give the gist of the lecture. That is, the process is the classroom, after the classroom instructions, at the end the students are asked to write the most important aspect which has been covered, and and responses can be collected by all or can be collected randomly anonymously. So again, this is also a self-assessment way, and it also helps in the diagnosis of the knowledge gap. Then 1 minute paper. 1 minute paper, in this the student recall and understanding is evaluated, and students in this process, at the end of the class, the students are supposed to write that what was the most important concept that has been learned in the lessons and what concepts were less clear. So it helps in assessment of both the students as well as the faculty, and then responses can be collected. So it helps in bridging the gap between the teaching and learning. So the edge of this method is that it activates the thinking and promotes the metacognition. Along with that, the same that self-assessment can be done, and reflects on the knowledge gap. Then one sentence summary is another tool. It helps that in which the students distill, simplify, and reorganize and synthesize into a smaller version of what all has been completed. So in this, by the end of the session, the students are required to answer the key questions on a piece of paper, and they are collected. The edges are same, that it helps in the self-evaluation as well as the metacognition. Then direct paraphrasing. It is also an important tool in the facts model, and in which the students, if they have learned and got the instructions in the lecture properly, then they should be able to express it in their own language. So that is what, because students must paraphrase the material, they must work to understand it, and that is the purpose of the direct paraphrasing. That 10 minutes before the end of the instruction or the lecture or the class, students are asked to write it in their own very own languages, and then responses are collected. This tool helps to provide the stimuli for the scientific definition, and definitely it helps in the self-assessment and metacognition. Then, as discussed in previous groups, also the muddiest point. This is it. This is the purpose is that learners are asked to reflect upon the contents taught, which are most unclear or poorly understood, and it enables the teacher to weigh the contents through the student's perspective. So in this also, the students are asked to mention about the most confusing or most poorly understood, and that it can also, online responses can also be collected, and at that very moment class also it can be taken up. So it also activates the thinking. Apart from this facts model, we can have other methods also, tools also, like the video assignment, that the students are asked to prepare, can be asked to prepare or submit 2 to 5 minutes video to demonstrate the understanding of the topic. Then mini assessment can be done in the form of the MCQs and the Google Forms. The Google Forms not only helps in the assessment of the students, but it also can be used for the faculty assessment also, in the form that yes, what students like most, what they dislike most, what they wish to be improved in the future lectures. So this way. Apart from this, yes no cards method can also be used, in which the teacher ask the question, and students they themselves will be evaluating by responding. That students respond by holding up the appropriate card, whether they know the answer or not. So in this way, they self-assess their assuredness on a particular topic, and the teacher reviews that yes, what is needed, or gives the that how much help is required by a individual attention can in this way be provided if the students are sincere enough and clear about. Then my opinion journal. This is also for more, I would say, enthusiastic students, that we can ask the students to create a my opinion journal, in which they are required or supposed to write about a specific topic, what they learned from this particular lecture, or the knowledge they gained from the other sources also. So it serves as a window into the student thinking and the learning. Apart from this, the student oral responses in between the lecture can, the few questions can be asked, then observations, peer reviews, or they can be asked to present the informal presentation. Then for few pictorial things, exercises, visual thinking strategies may also be used, which increases the analytical thinking, as medical students decode the images. So it helps and it increases the increased ability to find the multiple solutions to a problem. So it can also be used at feedback forms. Apart from this, problem solving activity, or in my institute we go for the this PSBH activity. So problem solving activity, in which the students are divided into the groups, and they are given a particular problem which they can solve in allotted time, and one of the representatives can present on behalf of each group. Now, with the more advancement and the students becoming more high-tech, then e-portfolios can also be used. E-portfolios is basically, it represents the compilation of the person's work, and with the startup of this CBME and the use of framework like milestones and interestable professional activities, e-portfolios may become a very effective tool. Now coming to the small group assessment methods, we can use poster making, that once the topic is explained, the students may be divided into the groups and assigned a poster which they can present. Then for checking out for those communication skills, we can go for the role plays also. Students divided and then they are asked to say the role play, what they do in the community and while their family visits. Similarly, debates or the then checklist to see who's contributing what, who is helping others. In this way, the students are encouraged to work together with everyone, having the chance to present their ideas, and checklists are given to the students so they themselves can evaluate. Then along with that, that OSCE and DOPs and small projects can also be allotted to the groups and they can be followed up. Then another tool is round robin charts. Round robin charts can be both in the form of the open-ended questions or in form of this write-ups also, in which the students are divided into 4 to 5 students. A chart is provided to them. There is no need of they are not allowed to discuss the thing. Every member of the group has to represent their ideas, has to write up their what they know about the topic, and then once the alarm or the bell rings, they have to pass it to the another person of the group, and this way, once the activity is completed, it can be discussed. So this is another tool. Then students reflection, then on how their group handled the process of the learning. The following survey can be used to tap the students' perceptions of how their group worked, like task, then what subtask was allotted to who does what, in what time, and then self-evaluation by the way that finished, not finished, or not at all attempted. So this was all from my side regarding the formative assessment. Now I would invite Dr. Venu madam to present the assessment of the knowledge.
Okay.
Dr.
Good evening, everyone. Am I audible?
Yeah, you are audible.
Okay. Here I am going to present the assessment of knowledge. Ma'am, kindly next slide, please.
Yeah.
Okay. We were given the assignment to create the type of questions from the competencies allotted to our group. So long answer questions, short notes, and scenario based short answer question and MCQ we have framed. Next slide. We have selected the long answer questions from the competency 7.5, and SLO here we selected is described randomized control trial and its types. So next slide, please. So we have created the question. Researcher wants to launch a new vaccine for COVID-19 whose safety is already established. So which design of the study is appropriate to assess the efficacy of this newer vaccine? If the students able to write the correct study type, study design, we will give 1 mark. Then next question is describe in details the steps to conduct the selected study designs. If the student able to write all the steps, then we'll give 4 marks. And lastly, explain biases that may arise out of this study and measures to avoid such bias. So we'll give equal 2.5 plus 2.5 marks for this third component. So this is how we have made the long answer question. Now coming to the short note, we selected the SLO 7.2.2 regarding discuss the modes of transmission of the disease with examples. So the question we created is discuss various modes of transmission of disease by giving appropriate examples. We can have 5 marks for such kind of short notes. Next slide. Also, we have framed another short note from the competency 7.6 on screening. The SLO we selected is differentiation between diagnostic test and screening test. So the question here is, next slide, define screening. We'll give 1 mark if a student write down the definition correctly and then differentiate between the diagnostic test and screening test. So here we have kept 4 mark. Next slide. Now coming to the scenario based short answer question, we selected the SLO 7.5.2 that is discussed about descriptive epidemiology. So the question we have framed is, an outbreak of measles began with a single index case who infected a number of other individuals. One or more of the people infected in the initial wave infected a group of people who became the second wave of infection. Then we have kept one epidemic curve. So student will have to identify. Yes, ma'am. Next slide, please. Student have to identify the type of epidemic from the epidemic curve shown above. If student does it correctly, then we'll give 1 mark. Then second, justify your answer by describing characteristic of that particular type of epidemic. So 2 mark is given to that. And lastly, list various diseases in which such kind of epidemic curve is observed. So this is how we have made the scenario based short answer question. Next slide. Now coming to the scenario based MCQ, we selected the competency 6.3 from statistics to demonstrate the application of statistical tests in assigned exercise of various study design. So we frame the MCQ like an investigator wants to study the relationship between maternal intake of iron supplements and incidence of low birth weight. He collects relevant data from 100 pregnant women as to status of the usage of iron supplements and status of low birth weight in their newborns. Now, the appropriate statistical test of hypothesis advised in such kind of situation is it paired t-test or chi-square test or unpaired t-test or analysis of variance. So this is how we frame the questions for knowledge assessment. Now coming to the skill assessment. Next slide. So we provided the assessment of tool based on the assessment method indicated, and the tool can either assess any skill, objective, or competency, or a whole competency. So the competency we provided was, next slide please. Competency number 7.4. We was to have to they given us the OSCE station from this competency: define, calculate, and interpret morbidity and mortality indicators based on the given data set. So we have to make the OSCE station based on this competency. So we have tried to make a OSCE station. The scenario is the student will be given these scenarios. You are the medical officer at one of the PHC of any tribal area of Gujarat. Now the maternal mortality in your area is higher as compared to national average. So you have to arrange a meeting with ANM and ASHA worker of your PHC to sensitize them regarding the issue of high maternal mortality. And you will have the following data of maternal deaths and live birth in your area for the current year. So the total population of PHC is 35,000. Total deaths among the pregnant women is 9. In this, deaths due to PPH 3, deaths due to accident 1, deaths due to burn 1, deaths due to APH 2, and deaths during labor 2. And total live births are given here is 1400. So from this, the student will be given these questions. You have 20 minutes to do the following. First, you have to calculate the maternal mortality rate for your area and compare them with the national average. Second, explain the ANM and ASHA worker regarding various causes of high maternal mortality in your area. Third, explain the possible preventive measures to reduce the maternal mortality in your area. So next slide, we'll have this performance evaluation form. We have also made the checklist for it, which I will share in the group once I finish my component. So here components are, first component is initiation of meeting. So skill of the student which we are going to analyze will orientation of the worker related to the purpose of the meeting, if the students do it or not. Then calculation and interpretation. A student has to calculate the maternal mortality from the given data set and has to interpret it and compare the rate with the state and national average. And lastly, sensitization of workers regarding possible causes of MMR in your area. And second, regarding possible preventive measures based on the causes identified for your area. So if the student does it, then we'll give 2 mark. If they do it correctly, 1 for attempted but not done correctly, and 0 if they do not do. We have also made checklist. I will shortly share it in the group once I finish this. So this is how we have tried to make the OSCE station from the competency provided to us. Actually, we were a bit confused how to make it, but we have tried our best and from the OSCE station, we can have discussion on it at the end of the session. So now I will request Dr. Shatabdi to take over.
Good evening, everybody. Am I audible? Hello, am I audible?
Yes, ma'am, you are audible.
Okay, thank you. Good evening, everybody. Thank you, Dr. Benu ma'am and Dr. Shalini ma'am. I am Dr. Shatabdi Mitro, now going to present Logbook, that is the assessment in community-based medical education. From the inception of the idea of the logbook, in the earlier days, it was used to determine the distance a ship has traveled. And this very concept have been adopted in the field of medical education to assess the student performance or self-reflection. Next slide, please. Our task is to choose any competency from community medicine which you think should be documented in logbook and to tabulate the details required to be entered in the logbook for the respective competency. Next one. Now the competency is CM 8.1. Describe and discuss the epidemiological and control measures, including the use of essential laboratory tests at the primary care level for communicable disease have been taken as rabies. The next slide, please. We all know that rabies is a highly fatal disease condition, but it is 100% vaccine preventable. And being a Indian medical graduate, it is his or her primary duty to know the preventive measures for rabies prevention, and our goal is to achieve the 0 deaths by 2030. The topic of us is visit to anti-rabies vaccine clinic. Phase 3 MBBS students of a group of 25 at a time will be taken by one or more instructors and will be conducted the activity for 3 hours. Next slide, please. The name of the activity being the visit to the anti-rabies vaccine clinic, and the components of the activity. In the pre-session activity, we will have an interactive lecture on epidemiology, that is the situation analysis, the epidemiological determinants of rabies, etc., and prevention of rabies. In the session activity, the students will have to elicit the history from the cases regarding the animal bite, like the numbers of the bites, sites of the bites, and severity, etc. Observe how to give the wound care, because wound care plays an important role in the preventive aspect. Learn regarding the anti-rabies vaccination, schedules, doses, site, and duration. These will all be followed by the feedback and discussion. Next one. Criteria for the successful completion of the activity will, the student will be able to summarize the observation and will have a record in the logbook, and they will be able to answer the questions asked by the facilitator. And for example, they can be asked the number of the post-exposure vaccination doses, number of the pre-exposure vaccination doses, etc. There will be the numerical scoring and documentation in portfolio or annexure of the logbook. Next slide. If the student or the learner is not successful, then we have to give the feedback with necessary rectifications and have to give a next visit on the subsequent posting, where in the next visit, as they have previously been discussed in the pre-session activity, the epidemiology and also the preventive measures in the theory portion, and they have had a hands-on exposure, it will be better for their more understanding on the current topic. Next slide, please. This is the tabular presentation where the name and the date of the competency addressed have been presented. Attempt at activity here is the first as assumed, and numerical scoring of the rating is given, that is maybe the below, meets or exceeds the expectation, and decision of the preceptor may be completed, repeat or remedial with his or her signature, and the feedback of the learner received or not. Next slide. Here we have taken one more competency, but why? The answer of this question we must give at the end of the presentation. And here the competency is CM 5.2. Describe and demonstrate the correct method of performing a nutritional assessment of individuals, families, and the community by using the appropriate method. Next slide. Here the phase 3 MBBS students in a group of 25 will be taken by one or more instructors for visit to the community for nutritional assessment of a number of families to reach community diagnosis, and this will be conducted over 3 hours. Next slide. For the purpose of the accessibility and convenience, a village that is covered under the service of the rural field practice area of the concerned institution will be chosen. And in the pre-session activity, there will be the interactive lecture on family study and community diagnosis itself. Assessment of the nutritional status, the various methods, the clinical examination, then the dietary survey, vital signs, then ecological methods, etc. And demonstration of the anthropometric measurements will be done. Next slide. In the session proper, the student will examine clinically the family members as a part of the nutritional survey following the WHO guidelines. That is the most important and important signs, and then the important signs which are not so clinically significant and the clinically significant signs. Then they have to assess the anthropometric parameters like as height, weight for under 5 children, mid upper arm circumference, etc., and learn regarding the important laboratory and biochemical examinations and vital statistics like mortality, morbidity of the community. Of course, they have to do for the diet survey by assessing the dietary intake by standard 24-hour recall method, and all will be followed by feedback and discussion. Next, for successful completion of the activity, the criteria will be summary of the observation recorded in the logbook. Students will be familiar with anthropometric measurements and diet survey, and they will be able to answer the questions asked by the facilitator. Like as for example, the facilitator can ask any of the students to volunteer and examine on his or her peer student to demonstrate, that is the how to do the mid upper arm circumference measurement. Like as we can do our plan, there should be numerical scoring and documentation in portfolio and the annexure of the logbook. Next one. And if the student is not successful, we have to give the feedback with necessary rectifications, and we plan the other visits in the subsequent postings. Next slide. Here's the tabular presentation. And according to the name and the date, the competency have to be given, and attempt of the activity first or repeat, then numerical scoring or rating, below meet or exceeds the expectation, and decision of the preceptor with his or her initial, and feedback of the learner with his or her initial have to be noted. The next one. Here is the slide we are giving that why the second competency have been chosen. The first competency, that is CM 8.1, describe and discuss the epidemiology and the control measures of rabies at primary care level, is not having skill component as mentioned in UG curriculum volume 2 book of NCI. And so group A, Framingham group, is inviting for the further discussion to the house for the same, and also on the entire presentation. The next slide. Group A, Framingham, cannot conclude without expressing sincere thanks and heartful gratitude to Dr. Manjunath sir and Dr. Pankaj sir, who were always there with their helping and guiding hands to make our presentation possible and successful today. Thank you.
Thank you, madam. Good evening, everyone. Am I audible, madam?
Yes, sir.
Good evening. First of all, I would like to thank and congratulate Team Framingham for a wonderful presentation and also bringing out certain points for discussion. Now, let us first look at the questions. Question box. Okay. I don't see any questions in the question box. Can anyone else see some questions? If yes, kindly bring it to our notice. Now the floor is open for discussion. Let us start with participants. We have finished a bit early only, so we have ample time for discussion. So I would like to invite the participants for sharing their questions, comments, opinions, experiences, observations, or reflections on these components that we are discussing. Anyone can come to the fore and express themselves, please. Or the presenters themselves, if they want to reflect on what went well, what could have gone better, if they want to reflect, that is also fine. They have already done it. They have already reflected on it. So, no questions. Any participants would like to come in?
Sir,
Yes, sir. Please.
sir, actually they did a very good presentation, very precise, very short and sweet. Probably what is happening is since we went through the whole PowerPoint, those discussion points can be brought again so that people again can think over and the bubbling of questions can start from there.
Yeah, so I request Satabdi Madam to bring out that conflict that
Yes,
the
sir.
team had.
Yes, sir.
Yeah, please.
Sir, actually, we had the conflict because sir, we have come to know from you, sir, that for the logbook presentation, we have to do some skill level of the activity. And so we were actually in not actually in hurry, but Venu ma'am took the all the responsibilities. A very big thanks to ma'am. And we tried ourselves at the last moment to make some modifications and some rectifications on it. We have made that thing, that is the logbook, though have to be planned for some skill level of the activity, but we have tried to put some knows and knows how component, that is the rabies vaccine clinic visit component, that is the CM 8.1. Describe and discuss the epidemiological and the control measures of rabies vaccine at primary care level. This is this is not the skill level component, but we have tried to make, as there are in the rabies vaccine visit clinic, there are many activities, that is psychomotor level of the activity, there are of course present from the participants, and also during their pre-session activities. So we made it a bit trial, that if from the house we get some inputs. And I think, sir, of course, there should be options and chances of having the modifications, or at least proposing the modifications of whatever the UG curriculum books are there. It may be from the very small try from us, but we can at least think over it, that as there are some activities which may be at the skill level, may not be at the skill level, but having some skill kind of components, like as for the vaccination clinic, if the student or the learner is taught with the wound care activities, then these are involving the psychomotor skills. And so that we have not deleted this one. Instead, we have tried another one more component, because another thing is that in the UG curriculum volume 2 book, that is under the community medicine, skill level of the activities are very less, only 3 or 4 are there. So we have tried this one, that is a skill level activity, we have also included. And this is the clarification from me, sir. Over.
Thank you very much, madam, for that lucid clarification. Now I will just tell a couple of other sentences. The question here was, what should go into the logbook? Since the MCI or NMC says that there should be a logbook, should we document each and every activity that we deem is as important or as relevant should go into the logbook, or should we really get it out? That was the question. So, and Pankaj sir rightly brought out the guidelines that it has to be shows how. That is, it is essentially a skill component should go into the logbook. So what we thought was the competency that was chosen was not completely appropriate or fully appropriate. So we have to each one of us have to think about it before we decide whether it should be documented in the logbook or not. But a visit, whether it is visit to a clinic or a water purification camp plant or a sewage plant, it is a composite of knowledge, skill, attitude. But still, can we select some competencies which addresses the hardcore skills? Was the question. So I will stop here. So any participants would like to comment or discuss on these issues, please. If not, I would like request Pankaj sir to brief us on this. Yeah, now we have some questions. I will read out. Jyoti
Yes, sir.
Madam has asked a very nice question. In SAQ, without reading scenario, also students can answer question. What is your view? Answers, please. Can anyone, the presenters, try to?
Sir, can we do one thing before we take those different questions? We will just solve this issue so that if no further question, we can close one issue.
Yes, sir. Please.
What I understand is skill is very important. As we were discussing, for my personal logbook or my personal portfolio, I can include anything and everything, whatever I want. But when it comes under the regulatory bodies and guidelines, it says very clearly the logbook should include shows house, and performance. Where shows house can be done by a first year, second year, and third year MBBS student. Performance under supervision will largely during the internship program. And that's why accordingly we need to follow the guidelines. When it comes to performance or the final skill, probably internship logbook, when it evolves either as a part of the same logbook or the separate logbook, it can be included. uh, that's why performance may not be an issue at this stage. When it comes to the skill, shows how and shows, and when it comes to K and KH, we need to understand all regulatory bodies talk about the minimum guidelines or minimum requirements. But a group of community like us, if we feel that we can take it to a higher level, then it is always better, which is feasible and also is evolved for a person to make a better primary healthcare physician, because the rabies is one of the important topic which they should know. And at primary healthcare centers, especially in the rural area with the dog bites and so many issues are going to come up. Also, many of the times they are going to be posted in these clinics where they will directly be doing rabies vaccination, anti-rabies vaccination themselves under supervision. Third thing comes the certification of these skills, which can be a part of the logbook. As we have discussed earlier, there are so many medical colleges, and it is only just a few years, or rather 1 or 2 years from CBME. Expecting a very high level in all the colleges may not be feasible, and that's why it's always to start a baby step and then move forward slowly, so that good standardization can be there in all over India. And that may be the probable reason in the beginning, in the first curriculum of the volumes which have come out, has only given 16 CM skills, and if you count with the integrated things, it becomes approximately 40 skills in CM without much certification, thinking that many of the skills can be integrated with the departments and the specialities which are going to come in the later part of the phase. And again internship, we are going to meet them. So since it is a beginning, we need to understand these are the minimum requirements, and as we move on, we can go to as higher level as possible. And at as many occasions it is being told that these volumes are the living document. That means as the time moves, these documents are going to be revised and upgraded and modified as per the requirements and needs of CBME.
Thank you very much, sir. The summary point is the logbook should be used prudently, and it should showcase the essence of community medicine with a focus on the skill at show and show how level. Right, sir? Thank you. Thank you, sir. Now,
Sir,
before
one
we...
more thing.
Yes, sir.
Sir,
Please,
one more
please,
thing which I repeatedly
please,
told earlier. Again, I want to re-emphasize. We need
please,
to
sir.
use the logbook for a purpose. The purpose is to assess that if the competency which is supposed to be achieved is achieved or no. And that's why we need to monitor the progress of the students rather than the progress of monitoring the logbook. Unfortunately, if we just keep monitoring the logbook, then the actual purpose of CBME, that is the progress of acquiring competency, will be lost. And that's why we have to monitor the progress of the students rather than keep monitoring only and only and only logbooks.
Okay. So again, I will paraphrase. So logbook is an indicator of students' progress. Okay, sir. Thank you. Thank you, sir. So before we move forward, I would like to solicit the opinions of other facilitators also. So many of them are with us. Animesh sir is there, Somdatta madam is there, Himashi madam is there, Himangini madam is there, Answer is there.
Sir, Animesh here.
Yes, sir, please.
Yes, sir. Sir, I by and large, I agree with most of the things that have been said and also the views of yours and Pankaj sir. I also felt that the group has attempted it very well, but again, I think one of the suggestions has also come in the questions that we'll take up in some time, I think. But the other thing is we have to also look at certain things from the point of view of what exactly is, as Pankaj sir said, my purpose. What is the learning that I'm expecting? Not just logbook for the documentation purpose, but what exactly I'm, because see, CBME, the whole thing, the shift is to see to it that there is competency. That means the graduates are competent, and that is something which has to be ensured. So at least we have to look at that and ensure that some of the competencies that come from our subject have to be learned. That being said, again, we also have to look at certain issues of feasibility. Now, I will come to about something else a little later, but in this right now we are talking about this logbook. So like I was wondering about that nutritional thing also. Now there are quite a few things to be done. Now they have to, like, the students have to go and examine the family members. They also have to do the, like, say learn about, I think, some investigations or something, and vital statistics, and they also have to do the dietary recall of those and then assess that. So quite a few things. I'm not sure that all these aspects and then one particular assessment in the logbook will take care and do justice. I mean, this is again my apprehension. So if we have to have, like, couple of things, or maybe otherwise we'll have to have each of these to be marked separately. Again, this is something which is one of my observation, maybe because of, like, having a quick this thing, I may not have realized it well, and I might have been over apprehensive, but the group can allay my apprehension in that case. So these are some of my submissions there as of now. Thank you.
Thank you very much, sir. A very valid point as to how can we focus on one particular component rather than having a set of components and skills. So that's what sir told. That is the take-home message. That's wonderful. I hope the entire team will agree. The group will agree on that. So other facilitators, please, before we take up these questions.
Manjunath sir, I just have a small query.
Please, madam.
I just wanted to go back to the long answer question that the group had presented. Can we see the slide?
Yes. Log answer question. Yes, madam. Not the competency.
Yeah, the
Go to the
question yes. So here, what I feel is that the question, the first question is directly related to the other two questions. So I feel that if the student is not able to answer the first question, like if he is not able to identify correctly the study design, then he won't be able to answer the next two questions. So in that case, he will get no marks in this question. So like ideally, I think we have to frame the questions in such a way that they are not related to each other, so that otherwise what happens is that if the student cannot identify the study design appropriately, then he will not be able to answer correctly the next two questions. So what is the take of the group on that?
Thank you, madam,
Am
for
I
bringing out that question. Yeah, the group, please. Anybody from group to take this question?
Yes, madam. You are absolutely right that if student does not know which type of study design it is, then he will not be able to write second and third questions. But what we thought is such kind of questions are very important and they are asked and a student must know about it. So by keeping that in mind, we keep such question. So, but definitely we can modify it second and third question so that student will not have to get the 0 marks out of the 10 marks. So definitely we can modify the question.
I
Yeah,
would also like
because
to ask the other facility. Yes, Manjunath sir. Yes, sir, please.
this is a vital question madam has brought out to the fore, because everybody debates about this point in various forums. So other facilitators and other participants, I think the question is clear.
Yes, sir. I would
Madam,
like to come in, sir.
yes sir, yes
Oh,
sir, please.
sorry. May I?
No, sir. Yes sir, please sir, please sir.
Yes, sir, Animesh here. So once again, sir, I would like to differ from the opinion of Dr. Himashri. With due apologies, madam, but I think I feel that I am for this kind of a question. I don't see a point that they have to get marks just because they are attempting something, and it should not be linked. See, the whole idea is that we are expecting that this is a must know, and they should be knowing these study designs, and not just study design, they should know the application of that. And if that is my objective, I am very well justified in bringing up a question like this, where the student should be able to give me that study design and should then describe about that. So if in the first place, if they can't identify or they can't tell me that, then they go wrong. And of course, other things also, they have to give me in right way whatever is expected in those subsequent questions. Having said that, I review a lot of question papers even for our own university, and so I have seen in other specialities even now there are some questions, and even in things like even in subjects like pathology and biochemistry, where they create a scenario, a clinical scenario, where if you go wrong in the first, you may go wrong in the next 2 or 3 questions, because they have these structured essay questions where they give a kind of a scenario and then ask. So I think, I mean, having said that, I think my point is that I think we can have that, and it depends on what is the topic I'm taking and what is the competency I'm addressing. And having that in mind, I think I'm okay. I'm for it.
Okay, thank you, sir. Actually, we all agree to disagree. So it's a very nice point that you have taken on. I also had some doubts regarding this, so I brought up this issue. And very nice input, sir. And just want to just deliberate on this issue, like if any more comments come up from the facilitators on this particular issue.
They will come, madam.
Manjuna.
They will come. Let us wait for
Sir
others.
Pankaj,
Sir, just
Sir
1 second, sir. Pankaj, sir, the participant. I just want to clarify that the participant can also opine. It is not restricted only to facilitators. Kindly come forward and give your opinion, because this is a very important question. Yes, sir. Pankaj, sir, please go ahead.
Sir, no doubt about it. We need to be student friendly, but we should not be giving marks to the students for nothing knowing the competency which is a must. So I agree with Animesh sir saying that if this is a must, it is a part of the competency which a student should acquire at whatever phase may be. If not able to answer the first, all other thing goes off, then it has to be accepted. And second thing is, if you go back to the assessment module which is prepared by NMC MCI, if you see that it encourages us for the case based scenarios, and even they have given how the question format should be given in the form of examples.
Okay, thank you, sir. Thank you, sir. So you feel that this is okay. This question is fine. Okay. Okay. Others, please. Other facilitators. Dinesh sir is with us. Khan sir is with us. Samdatta madam. Other facilitators. Praveen sir.
Sir Sundatta here.
Yes, madam. Please.
Yeah. So I think I agree with both Dr. Animesh and Dr. Himasri, but somehow that sounds very peculiar, I know. See, like obviously this type of questions we need to give because it's definitely fits the premises of the long answered question, and they need to be interlinked, which I totally agree. But at the same time, like especially for university exams, what Dr. Himasri I think is trying to say, it's very difficult actually to sample this type of questions because many a times with like Dr. Pankaj sir is trying to say not to be like to be student friendly, and we try to be like that. So that's why this type of questions actually are not preferred. So the whole issue actually is like this is not actually like preferred, but this type of questions are really important. And forming this type of questions, especially long answered questions, I think are very necessary. So my take somehow I think will be like something like that. Ki like let's take this actually for the formative assessment, may not be like for the summative assessment. So that's all. Over to you, sir.
Yeah. Now the question boils down to what is the objective of a long answer question? Why should we have a long answer question? First, we should understand that in a question paper, we have long answer questions, short answer questions, short essays or short notes, 3 forms, sometimes even including MCQs, 4 forms. 4 formats may be present. So we need to understand that each format has a purpose. Without a purpose, why should we have a long answer question? So now whether the question is technically correct or whether it is feasible or not, that's one. Technically correctness is one component. Feasibility is another component. Difficulty index for students is another component. So we have to strike a balance out of these 3, and then we have to reserve these questions for formative assessment, and we should restrict using these questions for summative assessment. But technically these type of questions are correct and they should be used to test the students knowledge. That's what Samrata madam told. Am I right, madam? Yes. Thank you, madam. Thank you. So any other facilitators or even participants, please? Let us all differ. There is nothing like correct. It is empirical science. Education is empirical science. It is not natural science. There is no constant here. Everything is a variable. So it keeps changing. No issues. So as long as we bring in valid points for and against, we will have a concrete opinion, and our application becomes much more robust and evidence based. So I would like to give an example. In clinical specialties, when such questions are formed, so a person aged so and so with acute abdominal pain presents with severe pain, fever, abdominal tenderness, and then on examination there is icterus so and so, it goes on. So what is your diagnosis is the first question. What is the line of management is the second question. So if it is acute pancreatitis and the patient, the student writes, I will do surgery or ERCP, the patient will take. So it is very important. The first question should be right. Second question is related to that because the diagnosis is most important. If the diagnosis is wrong and whatever he writes about the management, it will even cause the death of the patient. So there it is very clear that it is an all or none phenomenon. Because the crux, the fulcrum of the answer is the first answer. And if the second answer is dependent on the first answer. And if first one is right, everything else may be right or wrong. But if first one is wrong, definitely most of the other remaining answer will be wrong. So there are two schools of thought, whether we should have independent components, dependent components, or interdependent components. 3 words. And most of the people opine it is good to have dependent, and all clinicians opine it is good to have interdependent. I will not go into the details of this. So there are different schools of thought, and they are supporting all types of questions. And so now I will just conclude temporarily that this question is technically sound, but when we are using this question, we have to use discretion, whether it is going to serve the purpose or whether it is going to come in the way of our purpose. So I will stop here. If anybody else has opinion, we'll take it. Anyone else, please? Okay.
Sir,
But yes, sir,
Pankaj
please,
speaking,
sir.
sir.
Yes, sir.
Sir,
Please.
though we say this, finally we need to boil down to really that is important or no. And the second example, what we gave with the clinical scenario, also makes us to understand that it should be a real life question. If it's just a mere hypothetical question, then it may not serve the purpose, though the competency is important. So making scenarios as real life possible, because the life is not going to be a standard, isolated, standardized situation, which we can, or probably we use the word simulated situation. Real life is going to be real life. So if our all questions are as real life as possible, it will give the relevance. This question may or may not have relevance before COVID, though it is important for us. But after COVID, the relevance of this topic is totally changed. And I feel the student should able to answer this question, because that's the reality of life of today. Number one, sir. Second thing, I also want to bring the attention of how the student will write. Suppose I am the student, a good student, I will say randomized control trial. If I am not so good student, I will say randomized study. And third, I will say a randomized cross-sectional study. Now that 1 mark, how is going to be decided in these 3 words which I have told all, is also going to be a $1 million question for the exam who is correcting. Is this going to 0 and 1, or it is going to be 0.5? And if it's a 0.5 marks, then how other questions are going to be marked also is going to be a big challenging task.
Thank you, sir, bringing out another component from the evaluators or assessors perspective. When we see these varied answers and terminologies, and in between few keywords, right, appropriate keywords are also found. So how do we go about it? That is why it is said that there should be a trade-off between subjectivity and objectivity. The assessor can always find out whether the student deserves some marks or not, without any bias. And some people, including TS sir, that is Tejendra Singh sir, who is supposed to be a stalwart in the field of assessment, says that subjectivity is fine. The assessor can always use some discretion, whether it is a practical examination or theory examination, and award some marks. So that is another debatable issue. So if everybody is fine with it, we'll stop here and we can continue the discussion on the WhatsApp group. But if there is anybody who wants to share some burning point, please, you are welcome, please. Okay, so if that is the case, we will go to the question. Yes, who is this, please?
Sir, I'm Shatabdi. Sir,
Yes, madam.
Sir, is there any option for us to keep one model answer book or the model answer, that is the kind of the question bank, model answer bank? Then is it possible?
No, it has to be. In fact, that is the actually protocol, madam. Whoever sets the question should also give a key answer. Key answer does not mean he or she should provide the entire length of answer, but they should give the executive summary of the answer with references, standard references. So that is actually the protocol. But unfortunately, due to various feasibility issues, most of the universities are not following. But ideally, others can also give their opinion. Ideally, the question paper setter, we have done that. when we set question papers for DNB and university and other universities, we give the executive summary of the key answer. If it is a long answer or short note, if it is MCQ, specific key, which is the key, and also with references, we will give it. So if that is given, it is solved. But even despite giving the key answer, some assessors are so experienced, they have their experienced campaigner, they are still able to assess and give some marks because they feel that the student deserves some marks because he knows so much knowledge about the topic, though it is not relevant to the question. That is always there, and all of us will be affected to some degree by that. Okay. Any other points, please?
Thank you, sir.
Sir, I want to bring one more notice which we discussed just for the sake of discussion purpose. If you see here, my answer, I am a good student, sir. My answer of randomized control trial will be able to give me 1 mark. Then second is I will be able to write the steps of conduct of the RCT, no problem, 4 marks. Then the next question comes as a bias. Now, as an undergraduate student, as a community of community medicine faculties, we need to decide the marks of bias is given 5 marks. Do you feel as a community medicine professionals for undergraduate MBBS student, say even at 6th or 7th semester or the professional year 3 part 1, the marks which is given to bias is 5 and the RCT name and the RCT steps is 1 plus 4? Is the marks are justifiable to that level?
Again another point to discuss. See here, the distribution of the marks is what are the criteria which decides the weightage of the matrix for a given question. One is the length of the answer, another is the criticality. Even if the length is small, that is the most critical point of the answer, then we award more marks. But generally what happens is we go by the length, we go by the quantity. So quantitative versus qualitative component. So that is again debatable. Should we have more marks for the second component and less for the third component? That is also there. So that is why awarding marks has to be discussed and has to be vetted. Thank you, sir, for bringing in this point. Accepted. So we have had a long evolution from the era where I saw a question in the question 2002 or 3. The question was, write what you know about family planning. The student wrote, I don't know anything about family planning. So technically, we should award full marks because the question is, write what you know about family planning. The student wrote, I don't know anything about family planning. So the answer is technically correct, awarding 5 marks. So we have come a long way in the assessment of knowledge component. We will stop here. Any other points or opinions, please?
Sir, on the same topic or something else?
Sir, we will take up the questions, sir. There are some questions. On the same topic, you have anything, sir? Please go ahead, sir.
No, I don't have anything. That's why I don't have anything on the same topic. But I think
Okay,
you take
sir.
questions, and later, if the time permits, I had one point for OSCE.
Okay, sir. In SCAQ, now I am taking the questions. Jyoti madam has asked this question. In SCAQ, without reading scenario, also students can answer questions. What is your view? Any panelists, presenters can take this question. Shall we go to the SCAQ, please? Okay. Short answer question. No, not this one, madam.
Next slide, ma'am.
This one, huh? No.
Scenario based short answer question. Previous one, madam. Yes. The student can able to write down, but we kept the scenario because a student can able to understand the importance of such kind of epidemic curve. That is why we kept this scenario actually.
No, madam. What was the question, please? Let us examine the question again. No, madam. You stay there. You stay there. I will read the question. Without reading scenario, also students can answer the question. What is your view? But without seeing the graph, they cannot answer.
Yes.
They have to see the graph, and we have mentioned it as measles. Okay, so this graph is very important for them. Without this, they cannot answer the question. So the text part, probably the Madam Jyoti Madam is asking about the text part. So then we will always have two parts of a question. One is the functional part only, structural part only, structural and functional part of the question. So this graph is the functional part of the question, and this is the supporting part of the question. And the supporting part need not be functional always, but ideally each and every word in the stem of the question should have some functional part. But most of the time, because of various reasons, the functionality index of each and every phrase of the stem may not be of very high degree. That is to some extent acceptable, but Madam's point is valid and we'll accept it. Okay, so shall we go to the next question, please?
Can we see the questions that were based on this short answer question, please?
Answers,
On this
answers,
scenario.
answers. Okay.
Identify the type of. Okay, here the first one maybe a little functional, otherwise no. Oh, yes. Okay.
Yeah, actually, we can construct the second and third also based on the graph. We can construct. That is a
Yes,
possibility. It is a
yes, modified
possibility.
a little.
Yes, we can talk about incubation period. So many things we can talk
Yes,
about.
yes, that
So
would be more relevant.
yes, we can further see the take-home message is you can improvise on this
Yes,
question. That is
a
accepted.
refined
We can
and
we
it
can
is yeah, it
we can
has more value after that. Yes.
yeah, we can improvise definitely. So thank you.
Sir,
Yes, sir,
sir,
please.
Pankaj, sir. Sir, on the
Sir.
other way around, we can go in the reverse order. Now the question of madam is very valid that they may not read the text, just see the picture and answer. We can give the picture, and one question can be on the basis of the picture, whatever you understand, please write the scenario. Writing a skill or scenario on the basis of the graph is also a good skill which a student should learn and can be learned if acquired in a long period of time. So even the reverse order can be tried in the formative assessment, may not be possible in summative assessment.
Yeah, agreed, sir. So this can be what Pankaj sir is telling is a good question for NEET, both for UG and PG. It's a good question, but for undergraduate level 6-7 term students, depending on the institution, we can in the formative assessment definitely we can use. So the take-home message here is there is nothing called as the final format. There is nothing called as the best format. There is always scope for revision, refinement, and improvisation and innovation. Thank you, sir. That is the take-home message. So we'll go to the next question.
Yeah, and that is why review, peer review becomes important. So the others can give their comments and modify the questions accordingly. So peer review always helps.
Yeah, peer self-review, repeated self-review, peer review, student review, all of them will help us in improvising. Thank you, madam. So
Yes.
we'll go to the next question. For competency related to visit to rabies clinic mentioned in logbook, the skill that could be assessed and included in logbook can be administration of rabies vaccine and immunoglobulin in bracket technique and wound care using appropriate antiseptics. Running tap water for mentioned time duration, maybe using a mannequin or an artificial surface, say banana or thermocol piece, to, though not very sure about it. So Anubit Kujar has asked this. Any take on this query by the presenters?
Sir, what is the question?
A pretty long question. I will tell the essence. So can we use administration? I will just tell the key component of the question. Administration of vaccine and immunoglobulin plus wound care. Can we consider it as skills? So it holds good as the skill component. That's what
Yes, sir.
madam is trying to ask. And using mannequin or using some low fidelity simulation like banana, thermocol,
Yes,
etc. What is your take, madam?
Yes, sir, we
yes,
can
sir.
definitely do that.
Yes, sir.
Yeah.
Yes.
So since he or she is an undergraduate student, he cannot directly administer. In internship under supervision, he can do, but in as a student, he cannot. So this low fidelity simulation is fine. This can always be done. So very nice idea. In fact, in one of the webinar also, this was demonstrated. Thank you for giving that, madam. We accept it. No problem. No issues. So last
Sir,
one.
I have, sir,
Yes, sir. Yes,
Pankaj,
sir. Please.
I
Yes,
have
sir.
just one reservation with this low fidelity simulator or prepared simulator. We should keep remembering that our subject is slightly different from other subject, and the field-based training has more relevance on only simulated or low fidelity simulators and should not overtake the field-based training component what CM should give. Just a caution and reservation.
Great, sir. So now I will conclude. So the low fidelity simulation can only act as a complement, but it cannot supplant or replace the field-based training. Okay, sir? Right. It can be used, but with some caution, it has to be used. Okay. Agreed, sir. Any other views on this? Okay, we don't have any other question. The professor has asked, sir, please have some. Okay, that will happen. So because Animesh sir is waiting. Sir, over to Animesh sir, because Prasad sir wants discussion on ASCII.
No,
You
thank
also
you, sir.
wanted
I
to
don't
tell,
know
sir.
whether,
Yes,
yeah,
sir.
I don't know whether he has some point or question. No, my observation for OSCE was, and I would be happy if other facilitators as well as other participants can probably raise some issues or maybe share their own experience. I was just, first I should compliment the group that they have thought out of the box for OSCE. You know, they've given a scenario which is about the PHC in tribal area, and also that's a good and thinking out of the box, which is good. But I was just concerned about two things, sir. One is how exactly we will, because here they are asking the, you know, not just calculation but also to have a explanation to, I think, the ANM and ASHA workers, which also had some marks that, you know, whether they are going to do it correctly or not, orientation of the workers. And then there was also the thing which caught my attention was 20 minutes was given for the station. So I'm just concerned that 20 minutes feasibility wise, sir, probably, sir, Manjunath, sir, you might also give your expert opinion also. But I was just thinking that, you know, will 20 minutes not be too long? And in terms of feasibility, even with when we say 20 students, it may be like, you know, little difficult. So I was just concerned about these two things, though I felt that there was a good attempt, as I said, you know, to do out of box thinking.
Thank you, sir, for bringing out this point. So operational feasibility, given the time required and the number of students and the resource constraints. Over to the presenters, please.
Yes, sir. Definitely, this will take much time for all the students to complete this OSCE station. But from the competency which we were given, ideally we can make only one question on calculation of maternal mortality rate, and we can have the interpretation and comparison with the national and state average. But what we thought that we can also include such kind of other skills also we can check from the student. So we kept two other questions like sensitization of ASHA worker and an ANM. But it will take much time to judge
So
in
what
that
can be
too.
done, madam? Sorry.
Sir,
Sorry.
we can actually, sir, for OSCE station, I read much today regarding OSCE station because I was a bit confused about it, and I have never made any OSCE station. Frankly speaking, this was the first attempt I have made the OSCE station. Then I came to know that OSCE station is basically what we are doing in spotting. I think this is that they are mini OSCE station actually. We are giving in the spotting to the students in our regular examination. So then I realized that there are 10 to 12 OSCE station, and minimum marks are there, not much marks are for one OSCE station. So I thought we can keep only one question. If we want to cut short the time, we can ask the student to calculate the maternal mortality rate and compare it with the national average, or second most, if we want to keep, then we can tell the student to interpret his or her answer. So we can
Okay.
keep these two questions, we can keep separately in second station.
Thank you, madam. Thank you for that explanation. Now the question arises, if it is only calculation part, why should we think in terms of ASCII? As well, we can have an exercise. Epidemiology and statistical exercises will be there. Similarly, we can give them the exercise. Instead of this, ASCII is a very resource intensive exercise. So all this is not required. All students will sit together, they will write independently, they will give answers as we were doing before. Just because we have to do an ASCII, so why should we do? That question arises. So then it becomes a response station. So if we have only response stations and rest stations, that is only RR stations, but no P stations, that is no performance stations, the validity of ASCII goes down drastically. So the question again comes up, whether we should have an ASCII just for the sake of having an ASCII, or only if a particular skill assessment requires the ASCII tool, then only we should use ASCII. So this question surfaces. I want others to opine, please.
Sir Pankaj.
Yes, sir, please.
Sir, now two things. Number one is I am really thankful that Madam is honest, and she said that she is prepared. Probably this is the first OSCE, and as Anime sir said, it is out of the box. If we supposed to give a Nobel Prize for this OSCE, we would have given to you and your group. Number one. Second thing, I'll come back to the blueprinting. Any question is required if it is to be as a part of my competency needs to be achieved. If with that perspective, if I feel this, the second component of ANM, Asha worker and other things is part of my competency as an undergraduate student. So even if the sky falls, I have to do it, leave the logistic things apart. But if I feel that is not the real scenario, at 7th semester student, a simple calculation is good enough. I can break up the question into two parts. As sir said, it can go as an exercise, and for internship the OSCE component can come, because we need to understand CM is gets over only after the internship is completed, and that second component can be taken at the part of internship. So again we have to get to the basic origin. Is this competency to be acquired, yes or no, and at what level, at which year, at which milestone wise, how much to acquire, and accordingly we can plan for that, sir.
Thank you, sir. So, sir is telling, let us have a staggered approach, wherein we have the one milestone accomplished during 6th, 7th term, then the final milestone accomplished during internship. Thank you, sir. That makes sense. Great. Thank you. Any other opinions?
Sir,
So
as it
based
has
on
come
my
even in the
knowledge, yes, sir.
Anyway, sir,
Sorry,
please.
Yes.
I'll just say that it's also come from Ankita Jacob in the questions, that in the above scenario, I think 0.2 can be OSCE. So I would also tilt more towards that, because that will be more of a OSCE rather than just calculation, as you said, sir. Because it doesn't become a performance station; it will be more of a response. So instead of that 0.2, that is talking to the ANM ASHA workers, I would prefer that to be an OSCE in this rather than the other one, and within the time. I think Dr. Venu was saying something. Dr. Venu, you can go ahead.
Yes, sir. Actually, what I learned today from my reading, that we can have the 3 station or any 10 station, but 1 or 2 station can be from the one scenario only. So in one station we can ask about calculation, then second station we can ask explain the ANM and ASHA worker regarding the causes, like that.
So that is a coupler. That is a coupler you're talking about. So you
Yes.
can have that. Yes, I also thought about that. So you can have it that
Yes.
way, as you rightly said. So that was another thing I wanted to say. So, and Dr. Manjunath can also add to that. So you rightly said that, one station can do something about one part of it, or maybe you can, have interpretation, or you can give just the data there and they can just interpret within the time frame of, say, maybe 5 minutes or something, and then the next one based
Yes.
on that they will explain. So that can be, so that's a coupler. Sir,
Yes, sir.
I'm done, sir.
Great, sir. Great, sir. So I was very happy that the word coupler was introduced here. So coupler stations are very popular. in the actual hardcore ASCII examinations, including MRCP. So these couplets can be made use of, where one is response, another is based on that. They will either based on the examination, they will write the response station, or they will do a calculation based on that. They will do some procedure later on. So ABC analysis, etc., etc. So that's really great. So I think that's all. Yes, sir. Please,
just
please,
1 or 2 seconds more. In a formative assessment, the faculty can become an A&M worker or ASHA worker as a role player at that session. A single student comes and can explain what actually wants to be explained in a role play kind of thing.
Yes, sir. Yes, sir. Possible. Students themselves can become, or faculty can become, non-teaching people, staff can become. Okay, sir. Thank you very much. So, but the group has turned out an ASCII out of a seemingly difficult competency. So that is really laudable. Thank you. So we have another 2-3 minutes left. I reserve it for other facilitators or participants for their concluding remarks. Anyone else has anything to say or share? Please go ahead. Participants or facilitators. Okay, if there is nothing, we learned a lot. I would request Pankaj sir to conclude the session.
Thank you very much, sir. Sir, you gave me the greatest difficult part of life. You are the best person to conclude in the short, sweet remark. And when I start speaking, I keep speaking, and I am worried if people will log out at 7:30. I can just say it is an excellent, good discussion and good short and sweet presentation. Finally, everything boils down to our understanding what competency to be acquired at what stage. And the second important component, unless that is assessed properly, the whole purpose of assessment will be lost. And finally, we'll have a Mr. Beans who will do the CPR, if you have seen the Mr. Beans CPR in one of the documentary. Thank you, sir.
Okay, thank you very much, sir. Thank you all. Take care. Good night.
Thank you, all of you. Thank you.
Thank you.
Thank you, sir.